Today I'm going to talk about light therapy for both melasma and hyperpigmentation. This has been a super controversial topic within the light therapy space, so that's why I want to dig deep into the science of this topic. Basically, what I find is that current light therapy and melasma studies do not show an increase in melasma, which is like the dark brown spots that you may have on mostly on the face. And the same is true for hyperpigmentation, but it has a different reason. That there's not an increase in those, but instead a decrease. And that is even the case with higher powered studies. So if there's lots of quantity of light shining on your face, even there, you basically see a decrease in melasma. There is a little bit of a problem because we don't have the quantity or even the quality of studies that we would like. There are 6 studies in total that I'll go over in this presentation. But yeah, let's dive deep into it. Now, the problem here, and let's explain a little bit about the context, is that there are many reasons that you may potentially have melasma. So it's not only light exposure, it's also medication, pregnancy, oral contraceptives. There's also strong evidence that I'll go into at the end of my presentation, that some other reasons such as mitochondrial dysfunction, the circadian rhythm disruption, poor indoor lighting environments with lots of blue light, that those play either a minor or major role in the melasma or hyperpigmentation formation. And also that people don't optimize their sunlight exposure. So the way most human beings in modern society expose themselves to the sun is very unnatural. So we cannot conclude that sunlight is the main cause of melasma or a big contributor to it even, because there's far more context to it and much more research is needed here. Let's now dive deep into the goal of my presentation. I wrote a very big article, I think it's around 10,000 words, on the Light Therapy Insiders website. And if you want the full context of this discussion, then you have to read the article, because I go into much more detail there than I will in this presentation. Also, one thing I will say is that not everybody agrees with me. Many people in our Facebook group, for instance, they have different experiences with either the hyperpigmentation or melasma when they use light therapy, especially red light therapy products. Many of the people, or at least some of the people there, they have a different experience than what you will find in the studies that I'll come back to in a second. So many of the people have they do see an increase in melasma or hyperpigmentation, even though the studies basically argue the contrary. Now, a little bit of an introduction to the topic. The official definition is hyperpigmentation of skin refers to a dermatological condition which alters the color of the skin, making it discolored or darkened. So melasma is one type of hyperpigmentation. Other types exist, such as after medication use, because of inflammation, age spots, and then melasma is the one I'm going to treat today because it is the best studied in relation to light therapy. Now, before we move on to the topic of melasma, I have to talk a little bit about skin types, specifically the Fitzpatrick scale. There's a Fitzpatrick scale from number 1 to 6. Number 1 are skin types which have the least amount of melanin in it, which is the darkening agent or the substance that causes the darkening of your skin. And the number 6 are the people with the most melanin. So generally, people with skin type number 1, they burn but never tan. And people with skin type 6, they are already tan, but they tan very well and they never get a sunburn. I will say that the Fitzpatrick scale is not black and white, because you can have people, for instance, when I go to Brazil, to Rio de Janeiro, you have people on the beach who have like a type 5 or 4 or 6 skin with very dark skin, but they have blue eyes, for instance. So it's not black and white, but at least the scale is helpful for understanding that there are different tissues with different amounts of melanin in it. Now, let's talk about why hyperpigmentation matters. If you have these dark spots on the skin, then there's an aesthetic effect, and many people who have that, they have, if you look at the studies, their quality of life is affected. The full details are in my article. Often people use medication for that, or skin bleachers, or which are basically topical drugs that aim to remove the dark spots. The problem there is that they come with side effects, so people they'd rather have permanent solutions to the problem without side effects, or even in a more ideal world, prevent it altogether. Melasma is mostly found in the darker skin types, actually, counterintuitively. So Fitzpatrick scales 4 to 6 have the most amount of melasma. If you look at studies, around 8.8 to 40% of the populations are affected, depending on which study you refer to. So it's quite a lot of people who are affected by this. And yeah, I do want to question whether sunlight exposure is a big problem here, because sunlight exposure, the way modern people are doing that, is very unnatural. People basically stay indoors for most of the year, and then when it's summertime, when the sun is at the strongest, they go outside for many hours at a day. They use sunscreen, which allows them to stay in the sun much longer, which creates another very unnatural impulse. Also, and the reason why I bring this up is, if you have nutritional deficiencies such as vitamin C, vitamin E, astaxanthin, which is an antioxidant amongst others in fish, shellfish, etc. Collagen protein or similar proteins such as from gelatin or bone broth, vitamin A and vitamin A precursors such as carotenes. These are very important for the skin defense mechanism. So if you are deficient in those, then the risk of hyperpigmentation or melasma might increase. So in my opinion, it's very incorrect to blame the sun when people are walking around with all kinds of nutritional deficiencies that may cause problems down the road. Coming back to the sunlight, the unnatural exposure that I talked about, in a sense, it is like uh, never running basically, and then trying to run a marathon while taking lots of painkillers. That's what happens when you never get into the sun, and then at the hottest moments during the summer, when you are on vacation to the sun, then you go all out and stay for hours in the sun with sunscreen that allows you to stay in even longer. The best here, in my opinion, is to have slow exposure over the year. And one thing I need to mention is that infrared light is also protective. So if you get morning sunlight, your tolerance for the afternoon sun becomes much better. If you don't have the morning sun, then the afternoon sun exposure will be more problematic. Now, light interacts with melanin. Generally, blue and ultraviolet lights increase melanin formation, and as we'll see, green, yellow, amber, and red light and near-infrared inhibit melanin formation, and that, of course, has an effect on the hyperpigmentation and melasma in the skin. So next up, I want to go through all 6 available studies on light therapy and melasma. These make up the bulk of my argument. And what you'll see here is that even higher powered studies, so from 55 to 90 milliwatts over centimeter squared, and even doses that are very high, above 100 joules per centimeter squared, which is generally not recommended because people recommend like 60 or 70 as the upper limit for the daily exposure, that even causes positive results as opposed to negative results for the melasma. Now, study 1 that I want to treat is a review. And that review basically concludes that amber light of 585 and 590 nanometers, infrared light of 830 and 850, between 1 and 20 joules per centimeter squared, and I quote, exert a modular effect on tyrosine activity, gene expression, and protein synthesis of melanocytic pathway components. Melanocytes are the cells that make up melanin, and thus significantly reduce melanin content. Additionally, light therapy is effective in improving the dermal structure and reducing erythema and neovascularization. Erythema is redness, and neovascularization is the creation of blood vessels around the hyperpigmentation. Features recently identified as pathological components of melasma. So melasma is often paired with the redness and the blood vessel buildup. So then we look at specific studies. The second study I treat is a 675 nanometer light study. They use 3 treatments over 3 months. Study isn't perfect because there's no randomization, so there's no clear placebo or intervention group, but it includes 18 patients in total with Fitzpatrick scales 2 and 3. These people have facial melasma. The treatment parameters aren't really well described in the paper, such as we don't have the exact power output, but the study does mention that there's a 10-watt laser. And I know from experience going to some of these conferences that a 10-watt laser is very powerful. There was a scan before treatment, and then they treat with the laser on the areas of the melasma until redness and edema emerges, which is like slight swelling. So you know that they're using a very high dose. And there, when you look at the results of the study, you see that on average, there is like a moderate improvement in both in the visibility of the melasma, the pigment, and the vascularization. And you can see that on the chart that is displayed at the screen. We can also look at some faces. Here you see a woman. You see far less redness, and especially around the cheeks, their melasma has improved. Also here. Another woman who has far less pigmentation on her face, also around the cheeks and under the under the eyes. And one man who has less redness, and yeah, they basically have pretty decent improvements in their melasma. Study number 3 is a 5 nanometer light study, so that's amber light. Here they use 20 joules over centimeter squared at a low power intensity of 20 milliwatts over centimeter squared for 60 minutes and 40 seconds. The treatment area is 850 centimeters squared, so that's basically the entire face. There are 8 treatments over 8 weeks, so it's 1 treatment per week. Again, the study doesn't have randomization, so it's not perfect. And here we see that the light therapy on the skin inhibited melanin inflammation and blood vessel growth. Yeah, they also did some in vitro lab testing, and that also showed improvement in the mechanisms behind the melanin inflammation. The fourth study is a 633 and a 30 nanometer light study. Those are wavelengths that you'll see in the face masks or in the panels that many people use. The study uses the Fitzpatrick types 4 and 5. There are 60 females of ages 25 to 60. They get 4 treatments over 4 treatments per month for 9 months. And what's very interesting is the dose. The 630 nanometer light is dosed at 55 milliwatts over centimeter squared, and the 830 near infrared is dosed at 105 milliwatts over centimeters squared, which is very high. And they're even using a 20-minute treatment. So you get to a total dose of 192 joules over centimeter squared. That is the total dose, which is like triple that people would normally expose their entire body to during a normal red light therapy session. The study, if you look at the full text, they use the LEDs close to the skin. They use protective eyewear. Again, no randomization. The study isn't perfect. That's why we need more research. But I'm just telling you what the outcomes of all the studies are. And then the outcome of the study, I'm quoting. Both subjective and objective results indicated a significant improvement of melasma. Statistical analysis revealed significant improvements in both groups. The result of the study suggests that LED is effective in managing melasma, and the results will provide a basis for future therapeutic use of phototherapy to improve melasma. So this is the thing I said in the beginning that is counterintuitive. you'd expect that there was an increase based on anecdotal evidence of melasma, but the contrary is true. And the full text also states that there is no side effect. That's very important. Study number 5 is a 940 nanometer study. They use a lower dose of 13.5 joules over centimeter squared, but still a very high intensity of light at 90 milliwatts over centimeter squared. That's what you get at maybe the peak power output of some of the strongest panels if you're standing maybe at 4 or 5 or 6 inches from like a Platinum LED Biomax 900 or a Rojo Refine 900 or Block Blue Light Power Panel Mega. If you're standing really close, like probably at 4 inches, then you might get a 90 milliwatts over centimeter squared. It is pulsed. They have 8 treatments over 8 weeks. One side of the face is treated, the other is not. And the treatment area is 12.5 by 20 centimeters. There's one problem with the study. They also used microdermabrasion, so they disturb the skin a little bit. So it's not a perfect study to investigate the effects of light therapy only, unfortunately. But once you look at the results, and these are the results by an independent observer, so by the researcher, we see that there is with the part of the face that received the LED treatment with the 940 nanometer light, because look at the chart on your screen, there's quite a nice improvement overall. Most people have like a 50 to 75% increase. And in the control group, that's not the case. All the people in the control group either have a 0 to 25 or 25 to 50% improvement. The melasma severity goes down big time with the LED treatment, more than halved. So that's a really good result. And the melanin index, which is measured in the skin, becomes much lower from 1.6 to maybe 1.2. So that's a big improvement. And then we come to study 6. That's a study protocol, so I cannot really, it's not an intervention study, so we cannot use that. So those are the 6 studies that have been published on this topic. Now, once we go back to the study number 1, the review, we can basically say that my reading of the studies more or less aligns with the review that was done on this topic. The reviewer agrees about what the best wavelengths are. The review argues that blue and ultraviolet light may increase melasma. That is something I will disagree with, but I'll come back to it later. At least it doesn't necessarily cause it, in my opinion. And the review also suggests some mainstream solutions, which I may not always agree with either, such as sunlight avoidance, sunscreen, and oral or topical medicine to counteract the melasma. Especially the sunlight avoidance is super dangerous, in my opinion, because we have some reference showing that sunlight avoidance does as much damage to your health as smoking. So lastly, I want to say one thing, and that is Dr. Jack Cruz's treatment of this topic. I've known him as an acquaintance for quite a while and followed him, and he has some interesting perspectives on this topic with melanin, especially his argument and well-supported scientific argument that melanin is not just on your skin, it goes all the way into your body, into your nervous system, in your eyes, etc., into your brain. And his argument is that the circadian rhythm disruptions, so when we're exposed to blue light at night, for instance, that suppress our melatonin, especially blue light from screens and artificial light that enters your eyes, light exposure on the skin all day if you're sitting under LED and fluorescent lighting, poor mitochondrial function, that these can all contribute to melasma formation. And for that reason, it's, in my opinion, just because also what we know about the health benefits of sunlight. Of course, if you're stupid with sunlight exposure, or if you're, maybe I should say, if you're not really optimized the way you expose yourself to sunlight and do it in a dangerous way, then of course sunlight can be damaging. But the same is true for exercise. If I train like a maniac in the gym, or if I never run, the example that I gave earlier, if I never run and then I go run a marathon on lots of painkillers, that's a very suboptimal way of doing it. So that's why I also think that that there's a very big risk that people draw incorrect conclusions about sunlight. If you want to learn more about that, just read my full article. I've fleshed out the arguments in much more detail there. And yeah, finally, I want to end a little bit with some actionable advice. Here, I will say is please follow your own, monitor your own reaction to the light therapy, whether you're using a red light therapy mask or whether you use a panel or whatever. If you get an increase in melasma, please also share that in our Facebook group, because we're very looking forward to getting more data on this topic. If you get an increase in melasma, of course, then you change your exposure, so you don't continue with it. I am very interested because we also have some anecdotal evidence in our Facebook group from people who have used the LEDs, even as a case study by Alex of a woman who used red light therapy in part for her hyperpigmentation, but for her whole facial beauty, with both a panel and a Kineon Move Plus on the parts that she had issues, and she showed big improvements. And I'll also link to that study in the description below. And please be careful with drawing causal conclusions, in the sense that your medication, your circadian rhythm, your oral contraceptives, your diet, your sunlight exposure, sleep optimization, everything may influence the way that that your skin looks, and especially the pigmentation of your skin. So if you don't control for all the variables or haven't optimized those parts of your health strategies yet, then you may get different results than you would otherwise have. So one person who eats a perfect diet and sleeps well and minds her circadian rhythm might get very different results with the hyperpigmentation on the skin than a person who doesn't do all those things. Lastly, my research methodology, I want to say a little bit about that. I used all the studies from that Vladimir Heiskanen, who has an Excel sheet with, I think now 8,500 or 8,000 studies. He categorized all of them, and I used all the studies on melanin and melasma that he included there, which should be every study or almost every study. And I used lots of other studies on the topic that were related topics, such as on the nutrition, etc. I hope you enjoyed my presentation. If you have any questions, leave them below here. I'll try to answer as many as possible personally. If you have any comments or interesting perspectives on this topic, then also please leave them below. And I hope you enjoyed it. And yeah, here's another video that you may enjoy that I recommend watching as well.